I don't know any. My name's Omar Ibarra. I work with Shepherd Home Medical Equipment. I've been with the hospital for 15 years now, I think, with home medical equipment for 12. So today we kind of want to show you some of the stuff we offer. Not a lot of people know we exist in Emerson, to be honest with you. Even our clinics have no idea. They call me, we didn't know we have a TME here. So I just push the next button.
Yeah.
So I'm going to go over a couple of things we offer. As you can see, that's our address, 435 Northwest 11th Street. We're right next to the Marisol Clinic. Our phone number is 667-3477, and the fax is right next to it. We do offer on-call services for emergencies. So if it's for oxygen, nebulizer, and people are like, well, is nebulizer really an emergency? If you have a kid and they're sick, it's a big emergency. So we do have on-call services 24 hours. So if you call our phone line, and like I said, we're open Monday through Friday, 8 to 5. Anytime after that, it will go to the hospital operator, let them know what the emergency is. And usually our response is about 30 minutes. So if they don't respond in that time, they usually give me a call back and let me know, hey, something's going on. But one of the first products I want to show you guys, a lot of people don't know, is we carry oxygen. So the oxygen equipment I have today is an O2 Independence, which is this unit right here. So this unit is capable of doing 0 to 3 liters, 1 to 3 liters of oxygen, and it's portable. So if you plug it in, you can leave it plugged in and it's fully charged. So if you're ready to go on the go, unplug it and you can just roll with it everywhere. And you can pick it up right here. The one thing with this technology, this has DNA technology inside of it. So the technology in it tells me what the settings at. If there's a problem, it lets me know. It sends me an email. By the way, this machine is not working. An example is someone went to Honolulu, called me and said, my machine's not working. What can we do? And they need oxygen that day. So I went on, it was like 2 in the morning, I went on the computer, checked the DNA technology, found out that they unplugged it. So her husband unplugged it because he wanted to plug a CPAP machine in. So she plugged it in and it was taken care of. But that technology exists in this product. A lot of other products, oxygen don't have it. Like we have the 2 products you see on the left, the Drive and the Invacare. They do give you oxygen. They're for stationary at home. It's not portability, and those work great. They go up to 5 liters, but they don't have the DNA technology in it. So if there's a problem, we have no idea. With our oxygen patients, we go out every 6 months to make sure the equipment's working. If there's a problem, we swap out the equipment or fix it right there, right on the spot. The one thing you don't see on there is the portable concentrators. Everyone asks for portable concentrators. We were doing portable concentrators 6, 7 years ago. We stopped doing them because they're not reliable. We have tried 10 to 15 different versions of them, and every time they fail. We have one patient that went to 17 machines. So these machines are $3,000 machines. So if you went through 17 of them, and it doesn't help us. And then another instance that happened was a lady went to Montana and a small portable machine stopped. She bought it brand new, called us because she's from Emerson. I'm in Montana, my machine stopped. What's going on? It just didn't work. It worked for 2 hours and it stopped. This was a very common problem. And even when I go out to trade shows, I let them know the situation. They agree with me. They're nice, but they're not meant for long-term use. So it's usually about an hour a day max you can get one of those.
And so even on with that, is that we all see these cute little portable oxygen. I can bet probably, I don't know, 70% of people that are on those are not enough oxygen support for that patient. And it gives them this false hope, and they still go out in the world, they're still short of breath. They're not as short as if they're on no oxygen, but then they end up back in the ER. And then often those little things that maybe you've heard of where it puffs, they call it puffer, or they call it the pulse dose.
Pulse dose. So
Yeah.
the small ones are pulse only. So when you take a deep breath through your nose, it gives you a puff of oxygen. So what happens is customers get those machines, they buy it from Amazon, buy it online. I'm on a setting of 2, but if they don't breathe through the nose deep enough, which a lot of older people don't, it does not trigger it and it starts beeping and alarming. Sometimes they don't hear the alarm and they'll call me, I'm at Walmart, but I can't breathe. And I says, oxygen machine. And we used to do a test in the office where if you wanted that machine, we put it on you, made you do 100 yards, just walking around. If you got tired, take a break, and we make sure your stats were kept. The problem is, about 90% of the time, the people that tried it, their stats went down and the machine couldn't keep it up. We upped the machine to 5 or 6, the highest setting, the stats still went down. Where when one of these, a continuous of 2 to 3, which is oxygen doesn't stop going through, they helped them out. It worked for them. So we stopped offering that. Yes.
For something like that, that's portable, I know in my experience, insurance doesn't cover a lot of portable things.
Correct.
Would this be covered by insurance?
So insurance does cover this. So insurance covers the stationary unit and the portability unit. There's 2 different codes, E1390, that's a stationary one if I recall, and E1392, which is the portable. So like this unit can be built out as both, because you can take it on the go. This is my favorite unit. If I had a club one, I would want this unit. There is some cons to it. It does weigh 17 pounds, and a lot of people don't want to take this to the store. A lot of people are embarrassed, and I get that. But I try to explain to them is when you're at this stage, you need to, don't worry what people think, just make sure you take care of your needs. And that's what we try to do here. When we give them oxygen, we try to look through every option we have and explain why we're doing it and why we're not. And explain the other option that they want. If they do want it, we can order them, but we'll sell it as cash. We don't want to have to go through insurance on that.
And this isn't a concentrator?
This is a concentrator.
How much liter does it go up to?
Up to 3. Up to 3. So that's the only problem with that. It doesn't go up past 3. So
this part, when I interviewed with Elmer, like that, this was part of the reason why I took the job, because I've worked at other home medical equipment and they don't think about the patient first. And I know we probably, Good Shepherd uses another DME and they give them this portable because it's convenient and it looks nice and it's easy, right? And so if I get this right, Good Shepherd, we actually pay out more for this. It's more expensive.
it costs us more.
Right? So a lot of the other companies out there don't want to go with that because they're not making as much money, right? So, and this is what it is astonishing to me is that our hospital here, we only get Good Shepherd Home Medical. We only get like 33% of our referrals from our hospital, our own hospital.
Correct.
So that's 70 that are going out to another DME. And then I'm going to say everybody that works at these places, but Omar and Sid are definitely more cautious about the patient. And also what he does is if any supplies are on sale, he'll buy a bunch of them and then pass that cost on to the patient.
Right.
So.
She's correct. We care more about the patient and what fit their needs than actually with the other company to give them the cheapest possible. It comes to the seat that mask. They do the generic brand. We don't. We want something that will work right. Yes.
As a former board member, I'm curious as to why you're only getting 33% of the business referral from the hospital area.
We don't know. We have brought that to administrator. We talked to Jonathan. We let everyone know. We talked to the clinics about it. The reason we know this is we're part of a group called the VGM. They're a DME company that supports all the DME companies around the United States. If you have problems, they help you out. They have a show and they do analytics. So what they do is they take all the orders that were done in the last year from all the doctors. So they give them a zip code. They'll put all the doctors from Good Shepherd or any doc in this area and tells you they did 100 orders. 70 of them went to a different company and 30 went to you. I do realize unlike other companies, we want to make sure we have everything in place. So with an order, we need prescription, chart notes, documentation stating why. You can't just, hey, he needs oxygen because he needs oxygen. You need to have a reason why. You have to have testing to prove that he needs it. We make sure we have all those guidelines done, all those steps in place. And we let the customer know, hey, we have it ready. You can have it now. And once we have everything, you can wait. Step back. We can wait till we have everything that you can have it. So that way you're not hit with the bill. Or you can have it now, sign a waiver saying, I know you might not have everything, but I'll take it right now. The problem with that is the clinics get mad. Why are you asking for this? This is the guidelines. And we have a booklet that we took out to all the clinics. This is the guideline we have to follow and meet. Well, Lean Care doesn't follow that. So I understand that. But Lean Care also had $27 million
Yeah,
payback they had to do recently. A lot was a lawsuit that they didn't do.
and they don't mind if something doesn't get paid or here and they don't get paid for it because they overcharge all of their patients, so they'd rather be quick, fast,
Correct.
get it done. And so we think that it's just really a learning curve to really help and support, not just a learning curve, but to support our doctors and our providers to help them with all the qualifications, the CMs. And so that's what we've been trying to work on is alleviate that confusion. So we're hoping that's more what it is.
Correct. And we're being more like, I'm being involved in a lot more orders. So if they have an issue, they contact me and I'll be, hey, what's going on? Talk to my team to resolve it. Or if there's an issue with the doctor, I'm more than happy to go out and talk to the doctor to resolve the issue so that we keep the business in Hermiston, keep it with the hospital. Granted, the patient does have a choice. The patient should be given the choice to go wherever they want. So if they decide to stay with us, we want to make sure we get everything. We do everything we possibly can to make sure we get the proper paperwork and documentation so it gets paid.
Is it an Epic thing?
It is an Epic thing too. Epic, we need to get the Epic situation resolved. What we try to do is make an email that if you fax your orders to the email, we'll get it and we can work it that way. But what's going on is, hey, we sent you an order last month. We got no notification on Epic and no one sent us any information. So now what they're doing now, like Sleep Lab, they'll, hey, we have this patient, email it to us, and then we got it. Then we're working it within 2 days. So we're making strides at that. We're hoping to get that number up. In June, when I go back to the conference, I'm going to redo that data analytics there. So hopefully I get the numbers because we can't afford to pay for that. Okay, let me go to the next slide real quick. So next slide is power lift recliners. We do sell lift recliners at the store. We have a bunch of different options. We carry just Pride only. We used to carry Golden. We had a problem with Golden with the support, with the warranty claim. What it did, knocked the patient out, and they said, well, it's the patient's fault. I said, no, it's not. So we give them a Pride lift chair for free, take care of the situation. So now we just do Pride. Pride has been working good with us. We offer lift chairs from $800 to $3,000. If you're an employee, before you buy a chair, I would recommend stop and buy. The cost for employees cost plus 10%. So, but it's a lot of people don't know about the discount we have there. Lift chairs have been a big thing for us. We do a lot through the state right now. A lot of people that cannot afford it will go to DHS and then they'll work with us and we give them multiple options and they'll get a lift chair from us. We have different ones. The one you see there is a Viva Lift Line. It has a headrest that goes up, a lumbar support, and also has a cell phone charger and a cup holder. But what people don't realize is a lot of people love that chair because you can push the armrest in and they have grandkids coming over who have smartphones. They won't take the chair because they have no idea that the arms come out. So like I said, this is just another item we have in the store. Currently we have about 6 in the store. We keep them on hand. And the next one I want to talk about is ambulatory aids. What I brought today is a new product. It's a standard. We got this one this is a rollator. It has 4 wheels with a seat. So it's meant if someone who can walk but needs a break sometimes. It has brakes. You can help stop, lock it in. They can turn around, take a seat, and take a break at Walmart. It does not mean you turn around and pedal with your feet. That's dangerous. You have to tell people that. But we've showed this one, and this is one of the most higher end models we have. And the reason is if you fold this up, it folds down, takes up less space. It's more costly, but it's worth it. We do build insurance. We have a lower model called the Drive Mix, the R800, that we build insurance, and insurance will cover. What people don't realize is over the years, insurance has cut back on how much they pay for a rollator. So all the options we do have, if they want a nicer one, we could do an upgrade, ABN upgrade. So what they do is the insurance will pay their portion and they pay the difference for the upgrade. So not a lot of people in the community take that because a lot of people in the community are lower income, which is fine. But like I said, we have 6, 7 different types of rollators in the store. Like I said, we offer canes also. This is one of the Hurricanes. You probably saw that on TV. that add there, just basic canes, quad canes, crutches, everyone have crutches. Knee scooters, we do not, depends on your insurance, some pay for it, but we usually rent them out, so we do rent knee scooters, a lot of people aren't even aware of that. And then the wheelchairs, we carry from basic 16 by 16 all the way to 28 inches, and that thing like this big. So, on the same thing on the wheelchair, when we do a wheelchair assessment, we have to go out, make sure that if we want to work for the patient, measure doorways. Also let them know, you might need a 24, but your doorways are small. You can only get a 20 inch. How do you want to, what can we do about this? Because sometimes there's patients that have had to make modifications to the home because of it. So to be aware, we offer so many different types. Yeah. So, any questions on ambulatory aids? Because we have.
I will say I got a lift chair for my mother and
Yes.
it was cheaper than buying a chair from like the department store, like Walker's even.
Correct. And if you look at the department stores, they have a lot of different brands. We carry Pride, which is the #1 lift chair in America. So when it comes to warranty, they always have products. They always have the items in stock, like the controllers, the motors. So if they have a 7-year warranty, so if there's ever an issue, we will go out personally, look at it, fix the parts, get them replaced under warranty. And since we have a contract with them, we're obligated to do that. So we always do. We have people calling all the time just to get Pride from us because they know we would go out. So. Oxygen. So that's oxygen CPAP. So currently, there's a picture of the Resman machine right there. We do a lot of CPAP. Our biggest thing we do is CPAP. Or we do a lot. We have a resupply program called Connect. So I'm on it. I wish I should have took a picture of it, but they'll call you. So when you get a machine, every 3 months or every month, depending on your insurance, you're eligible for supplies. There is a phone call they can call and you walk through with them on the phone, or a text. Text is new, so we start implementing that. So you get a text and hey, you need supplies. You mark down the questionnaire and you come in the office. Within 30 minutes, we'll have everything. As soon as we get it, within 30 minutes, pull everything, have everything ready picked up. If you live in the outlying areas, we do drop ship. So if you let us know that, we will ship everything to your home. There is a limit we have to hit to make it cost effective, but we will tell you that. Usually a mask covers that pretty much. But we do a lot of CPAPs reconnect. I think we have 696 patients on it in the community, and it's only getting bigger. And the last year we did close to 300 setups of machines. So I want to get to the.
So real quick here too, with our CPAP program, it's a little different than a lot of other DMEs that when you get set up, even if it's your second one or third one, that our staff will sit down with that person for an hour and just go over everything and make sure that they're really comfortable with it. And then the patient can always call back, have another appointment, and this is really helpful for some of our folks that have a hard time remembering things. So they have that option, they have that support continuous through their whole 5 years. So.
And the big thing is, we sit down with you and do the setup. A lot of other DMEs, since COVID happened, what they're doing is they do the settings at the office and they ship it to your house. And they say, here you go, and here's a mask. We don't do that. Yes.
Just a question on there's a lot of advertising on TV now about maskless CPAPs. Are you looking into those?
I haven't started looking into it. We will look into it as we get closer. The biggest thing is, because since we are relying on people, a lot of people rely on insurance to cover them, that I'm aware of, a lot of those aren't covered by insurance. There's certain guidelines. It's just like people say they're covered. They say they're covered, but the guidelines are specific. Like an example is totally different item is a commode. Commode is covered, but if you can leave the room, or if someone can help you get up and leave the room to do the bathroom or get to the bathroom, it is not covered. So it's almost impossible to get a commode to be covered. So like, hey, don't you have a caregiver? Yeah. Well, they can get you up into the bathroom, so it's not covered. Same thing with these specialty ones. They can get paid, but they're at certain guidelines, and I have to look into them more. And we're looking at a lot of different areas. like diabetes supply. It's a new, there's no one in the area that really does diabetes, so diabetic supplies. So we're looking at that right now. We're looking at, we do compression, we're looking at rebuilding compression. So, but you're right, we will look into that, see if there's any more, if there's something we can do with that. But yeah, technology has advanced. I know there's mouth guards too, people use, because I tried the mouth guard and the mouth guard did not work for me. So now I have a CPAP machine too. Like I say, back to the supplies, we carry all different types of masks. You have just the pillows, you have the cradle mask that goes underneath the nose, you have the full face, and you have the one that goes over the nose. When you come in with us, you're offered any option to try. Some people start off with the full face mask if they like it. Then at 6 months on the road, they want to switch to a different mask. It's okay. We can do that. A lot of other companies don't even give you the option. It says, here's the mask. And that's it. We want to make sure you're comfortable with your selection and your compliance. When you get a machine, you have to use the machine. You're required of a minimum of 4 hours every day. We want to make sure that we help you and hold your hand to make sure you accomplish that. We call you and follow up. And the mask is the biggest thing there. Any questions on masks? Okay. Go ahead.
So this little gadget right here, this is an actual ventilator, a full support ventilator. So if someone who's ventilated dependent can actually use this. It's incredible. But we use it for modes that are more for people who have CO2 retention. So we have a COPD program that we've been building. And this is just what one of the, I have another vent, but it's like 5.5 pounds. There's a battery on it. And so there's 2 modes on it. One is for people who have that CO2 retention because they have just terrible lungs and they can't blow out that bad air. And then the day mode is for patients that really struggle to breathe during the day, and they can wear it and kind of walk around while wearing it, or they can put oxygen in it. So this is just a program that we've been building trying to reach all of our patients that have COPD. So if you have come across any patients that have COPD, you can contact us. And how it works is I'll call up the patient and say, yeah, I have this program, and it's more about getting that information of the disease to that patient, and then also being the liaison between their primary doctor, between the hospital, because often these patients end up in the emergency room, and then looking at their charts, see what they can qualify for whole modalities. And the whole idea behind this COPD program is to save millions of dollars a year from getting these patients on the right modalities before they constantly are ending up in our emergency room. And then just their quality of life improves daily. So just keep all that in mind. If you have any family members that have COPD, just let us know.
Okay. So about we do sell compression. We carry Medi and Juzo, so the top 2 brands of compression in the medical field. About some examples. So Juzo makes the Power Vibe, they make diabetic socks, and the compression range anywhere from 8 to 12, 15 to 20. They make the wraps. So we try to carry the basic 15 to 20, 20 to 30, 30 to 40. We never built for them because it was complicated to build for them. Some new guidelines of this, Medicare just passed a new law, a new act for lymphedema. So starting at the beginning of this year, we are now able to bill for certain compressions. So we're looking into that right now, making sure we have all the proper documentation needed to do that. So a lot of people are like, well, I don't like compression. Why do I need compression? A lot of doctors recommend compression for everyone. If you're on your feet, especially if you're on cement. When I first started, I had no idea what compression was. I'll be on cement all day. Our warehouse is cement. I get home, my feet hurt. This all day walk on cement. Try to compression on. Come to find out, it's a lot of compresses your ankle, so that makes the blood circulate up and down. Juzo and Medi do a very good job. We have 2 brands. Medi also has a brand called SEP. So that's where people that think, well, it's a medical. No, not necessarily. SEP is the sports line. So you can go up by shoe size. We don't recommend shoe size, we actually recommend measuring yourself because me and Katrina could both wear a size 8 shoe, but my calf could be 3 times her size. So that changes everything. In the office, we do measure everyone. We recommend coming first thing in the morning, that way you're not swollen, or when you first wake up. I know some people wake up at 1 or 2, which is totally fine. But the CEP line is one of my favorites. I wear them every day. I'm currently wearing some right now. We also have, as you can see, the knee circle. We are now carrying knee compression sleeves. We have the light, medium, and max compression sleeves. We're noticing that a lot of the community members are liking this, and a lot of employees are coming in. Yes,
They're very difficult to get on.
they are.
Do you also
So-
carry the little butler thing?
Yes, we do. We have the Medi Butler, the small one, the big one. We also have the plastic ones. I don't recommend. Or if you can afford the Medi Butler, which is like $35, $50, and the one for $70, it's like this big, and you just literally put your sock on, put your feet in, and pull on. I would recommend that if you can. Because if you wear anything higher, I wore 20 to 30s yesterday, that's a compression level, and I was sitting there, getting them up. So they're not the easiest thing to put on if you, but they help out a lot, so it's worth it. So if you do need help, we do have butlers. They're called Medi Butler, but there's different sizes. If you're a bigger person, get the bigger one. It is more expensive for the butler, but it's worth it.
So this one is $20.
Correct.
So, but with the employee discount,
It's like 10 or 11.
yeah. They are worth it.
Yeah, so we have the no-show socks, we have the ankle ones. And here, I'll pass it around so you guys can see all these here.
I'm wearing those right now.
I'm putting one slide.
Which color do you have on?
I can say the exact same ones.
Nice.
Yeah, they're my favorite.
I'm just gonna skip a bunch of slides.
Yeah, I got
So,
them.
one last thing I want to mention is, this is the SIA, this is the Medicare.gov, thank you. This is the Medicare.gov website. And if you can see, so we're part of the hospital. We are the only DME company in this area that accepts assignment. And explained to, this is a Medicare guide. Medicare approved amount is a total supplier can be paid. When the supplier accepts the Medicare approved amount as payment, you won't be billed for more than the Medicare deductible and co-insurance. That is followed throughout every insurance guideline we have. We're the only only DME company in this area. So if someone comes to us, they will get the better pricing. If you go to the CMS website, you have these are 4 examples of different companies in Tri-Cities in the area that we compete with. If you look at us in the bottom left corner, we're the only one that has that little dollar sign, which says charges the Medicare approved amounts you pay less out of pocket. No one knows about this. So that's one big thing we try to tell people about is we're accept assignment. So if you get stuff through us, it's always going to be cheaper. Correct. So because a lot of people don't know that Norco is also on that list, but they're not accept assignments. So you pay more out of pocket.